Welcome back to The Explainer. Okay, let's dive into this. Today, we are embarking on a strictly objective, deep dive into the absolute nuts and bolts of chiropractic care. We're looking at the anatomy, the theory, and the real-world practice. It's a topic that definitely generates a lot of discussion, right? So our goal today is to strip away all the noise and look directly at the foundational texts, theories, and everyday practices that define this profession, so we can see exactly how it operates under the hood.
Here is our roadmap for today's deep dive. We'll kick things off with origins and definitions, then we'll unpack vertebral subluxations, move right into diagnostics and techniques, explore applications and risks, touch on global regulation, and then funnel all of that down into a really clear executive summary with our key takeaways.
All right, Section 1, Origins and Definitions. Let's look at the roots of chiropractic.
So the word chiropractic actually comes from two Greek words. You have chir, which means hand, and praxis, which means practice, or literally, done by hand. At its core, chiropractic is a primary healthcare profession focused entirely on the anatomy of the spine and its immediate articulations. It targets mechanical disorders of the musculoskeletal system. But here is the absolutely critical hypothesis behind the whole thing, and really why this matters to how the practice operates. Practitioners believe that these mechanical spine disorders directly affect your entire general health via the nervous system.
You might be wondering, where did this specific idea even come from? Well, it was founded in the United States back in 1895 by a Canadian named Daniel David Palmer. And surprisingly, just for a little historical context here, D.D. Palmer actually had absolutely no conventional medical training. None. The practice was later expanded and codified in the early 20th century by his son, Bartlett Joshua Palmer, who really helped shape it into the distinct profession we recognize today.
Today, chiropractic is officially categorized as part of complementary and alternative medicine, or CAM. Now, for you as a patient, this distinction is absolutely vital. It means that chiropractic treatments are fundamentally different from those you'd find in conventional Western medicine. In fact, some of the core uses and the underlying evidence base for chiropractic treatments aren't recognized by the majority of independent scientists. It literally operates on a completely different paradigm of health.
And that paradigm is deeply rooted in a holistic philosophy. Practitioners believe that the body is essentially a self-regulating machine, able to maintain and heal itself in most cases. As this foundational quote illustrates perfectly, it is the body that conducts and manages the process of healing and not the doctor or externally applied forces. So a chiropractor's objective isn't actually to heal you directly, it's simply to remove interferences so your body can do the healing itself.
Moving on to Section 2, the core theory. We need to talk about vertebral subluxations, which is really the absolute linchpin of this entire practice.
Now, what's really interesting about this slide is how it visually anchors the physical mechanism we're talking about. Just look at the highlighted area on the spine there. You've got the vertebrae and the spinal nerves. A subluxation is the term chiropractors use when one or more of the bones in your spine move out of their proper position. As you can see right there, this misalignment is believed to create physical pressure on your spinal nerves, essentially causing them to malfunction.
And that creates what is basically a four-step cascade effect which forms the entire basis of their treatment model. Step 1, you have the spinal misalignment. Step 2 is the resulting pressure on those surrounding nerves. Step 3 is the signal interference, which is essentially blocking the flow of natural energy or nerve impulses. And finally, Step 4 is a decreased health potential. Because the nervous system controls all the functions of the body, practitioners believe this blocked flow causes the whole system to function at less than 100%.
This theory then builds out into some very specific biological claims. Chiropractors classify the resulting damage into 5 specific categories. They claim it leads to neuropathology, which is nerve damage, kinesiopathology, or joint damage, histopathology, meaning tissue damage, myopathology, which is muscle damage, and finally, pathophysiology, which represents an overall decline in general health. Okay, Section 3, Diagnostics and Techniques. Let's look at the clinical approach.
If you were to walk into a clinic tomorrow, this is exactly what you would experience before any treatment actually begins. Chiropractors use a really comprehensive examination process. It starts with standard history taking, obviously, followed by a spinal inspection, looking for things like hypo or hyperemia, which are changes in blood flow that they associate with a subluxation. Then they use manual palpation, literally feeling the static vertebral position and muscle attachments to identify abnormal segmental motions. They'll also run through range of motion testing, muscle strength testing, and specific orthopedic or neurological tests.
Once they've identified the issue, the goal is what they call an adjustment, the specific application of force to correct that nerve interference. And this generally falls into two distinct categories. The first is manipulation. This is a movement of short amplitude and high velocity that actually moves the joint slightly beyond the limit the patient can move it themselves. The second is mobilization. This utilizes much softer movements administered within the physiologic joint space, simply to increase overall range of motion. Understanding this difference is absolutely key to knowing exactly what type of physical force is being applied to your body.
Next up, Section 4, Applications and Risks. We're looking at indications and contraindications.
So treatment is typically indicated for mechanical issues. We're talking neck pain, mid and lower back pain, tension headaches, and sciatica, specifically where disc bulges are contained to less than 5 millimeters. However, there are very strict, hard medical boundaries where this cannot be used. A chiropractor should never manipulate a spine in cases of malignancy with metastases to the bone, tuberculosis of the bone, fractures, acute gout, or excessive spinal osteoporosis. Those are hard contraindications.
But beyond just treating back pain, the profession claims a pretty wide array of broader benefits. These include increased joint flexibility, reduced chronic pain, improved posture, and the prevention of spinal disc degeneration. But it actually extends even further into claims of improving organic functions, like the heart and digestive organs. In fact, a core assertion within traditional chiropractic philosophy is the rather astonishing claim that spinal manipulation can result in the treatment of about 95% of all health conditions.
All right, Section 5, Global Regulation. Let's talk about statutory oversight.
Despite being categorized as an alternative medicine, chiropractic care actually operates under really strict statutory regulation in many parts of the world. In fact, the statutory regulation of chiropractor works in much the same way as the regulation for conventional medical doctors. The title chiropractor is strongly protected under legislation, like the Chiropractors Act 1994 over in the UK, for instance. It's overseen by official bodies like the General Chiropractic Council, or GCC, and councils like the TPMC in Ghana. Basically, it is entirely illegal to practice without official registration.
Finally, Section 6, the Executive Summary. Let's distill all of this down into our key takeaways.
So the crucial point is really a synthesis of everything we've just covered. If you remember nothing else from this explainer, remember these 5 pillars. First, chiropractic was founded in 1895 and remains firmly categorized as complementary and alternative medicine. Second, it relies on a deeply holistic philosophy that prioritizes the body's innate ability to heal itself. Third, its entire core focus is on identifying and treating vertebral subluxations to remove nerve interference. Fourth, it achieves this primarily through manual physical manipulation. And fifth, despite being alternative, it is strictly governed by statutory regulatory councils globally.
Which leaves us with a really fascinating question to ponder. As the lines between complementary and conventional medicine continue to evolve, how might the integration of these deeply holistic practices fundamentally reshape our future approach to total body health? Thank you so much for joining me for this explainer. Keep learning, keep questioning, and I will see you next time.